For this week's case of the week, I saw an interesting one come across my desk. This is an e.max crown that the dentist tried into the mouth and it fit, but he noticed that he could see the cement showing through the facial. You know, you can kind of see the outline. It's a little tougher to catch on camera than it is just with the human eye, but you can see the outline of the preparation basically. And if you look at the inside, you can see that there's a yellowish cement that has been used. So that's part of the reason why it's showing. You know, you could use a translucent cement and you know, have a better result. Or there could have been a little more reduction. We were a little short on facial reduction. It was right around 7/10. We'd prefer a millimeter, so that didn't show through so much. But it got me thinking, because e.max is so translucent, or can be so translucent, it got me thinking not only about cements, but about stump shades as well. And it would behoove you to let your laboratory know about the stump shade, and perhaps even if you're going to use cement that isn't translucent, for example. And so when you get into bonding, most of the resin cements do have a translucent or a clear variation, which is slightly yellow, as it kind of should be to blend with the dentin. But most crown and bridge type cements, you know, Reliax Luting Plus is white, Ceramer is white. This one appears obviously not to be a resin cement, but it's also yellow. I'm not exactly sure which cement that is. So certainly when you're dealing with translucent restorations and you're making that decision between should I cement this or should I bond this, that might steer you a little more towards a resin-based cement because they do come in translucent. But we've also seen issues with dark stump shades on endodontically treated teeth showing through as well. And even sometimes metal post and cores where the doctor feels like he would really damage the tooth if he tried to remove that metal post and core. So this is one of the impulse ingots of e.max. This is one of the newer ones from Ivoclar Vivadent, and it was really designed for no prep veneers. So that it looks very enamel-like. It was basically made to kind of replace enamel, but it also looks very good when it's used in crowns, and I see more and more technicians using it because they really like how it looks, but because of the translucency, this is part of what can happen. And so it got me thinking, well, what would happen if this was done, this same crown? So we're going to take this same crown and go back to the CAD/CAM file and mill this same crown. I'm going to mill 4 more versions of this crown and then try something. And we're going to take IPS e.max LT. So this is the low translucency version of e.max, whereas Impulse is definitely more translucent. And I put 2 like stump shade clay materials in here. So you can see we have the yellow one for kind of representing that same type of cement color, and then a little darker one to kind of represent if we had maybe an endodontically treated tooth or just a dark stump. And in the LT, the low translucency, you really don't see much of a difference between the two. This is still e.max, just like that first crown. It's just not as translucent as that first crown because it's the LT, the low translucency. This is the original e.max that we started using in the laboratory back in 2007. And there's a case online at glidewelldental.com where I actually have 4 e.max crowns, LT, the low translucency, on top of 4 metal posts and cores, and you cannot see them through the e.max at all. But keep in mind they were properly reduced, they were adequately reduced so that we had enough room. If I would have tried that with these LT crowns, then I would have had 6 or 7/10 thickness on the facial surface. I'm pretty sure that they would have shown through. I'm not sure if you see maybe a little yellow showing through on this one. Again, this is the same exact crown from the same file that was milled, but it's tough to, so again, this is the LT, but it's at a very thin dimension, and I do now think I see some of the yellow showing through there. Maybe not so much with the brown over on this side. In fact, this one looks to be a lower value than that one does, but they're identical crowns, exactly the same as that first one that had the yellow cement on the inside of it. And so if you've got a dark stump shade or you prefer to use a cement or bonding in with something that's not translucent, letting your lab know will give them an indication about, okay, maybe we should use the LT, the low translucency, or maybe they'll use the HT, the high translucency, or the impulse, but they'll do some internal opaquing on the inside of the crown to keep that from showing through. So there's definitely ways to deal with it if you give your lab a heads up. And then I thought, I wonder what it would look like if we did it with zirconia. So again, with that same CAD/CAM file, we milled 2 more crowns, and these are BruxZir, and with the brown and the yellow on the inside of it. And zirconia, full contour zirconia, is still not as translucent as e.max, and so you'll see you don't really see a hint of the yellow there at all on this one. And as we look at the brown as well, I don't really see any show through, and you wouldn't expect to because it's not as translucent a material as the e.max, and you probably get that feeling, you know, even as you look at it and say, yeah, it doesn't seem like it looks as, you know, as tooth-like as the last crowns that we looked at, the e.max crowns. And so that's another way to be able to do this. In fact, the one reason where I go to e.max veneers, BruxZir veneers, I should say, for example, is on a deep tetracycline case. You know, the problem with tetracycline cases is as you try to prep more in order to get a thicker veneer, you get down to the darker color into the dentin. And so I've started to do tetracycline cases essentially as no prep veneers, only removing tooth structure where I need to achieve ideal arch form. And putting zirconia on top of that blocks it out much better than almost anything else. So it's not as translucent as e.max, and so you're not going to see as much. But even though it's not as translucent, a full 31% of the anterior crowns that we did last year for doctors were BruxZir crowns, but that's mainly for the strength more than anything else. Because you've got something here that's virtually indestructible. In fact, when you look through remake rates here at the laboratory, you're not going to see a lot of fractures of e.max in the anterior either, just because we don't have those same biting forces there. So, whether it's the solid zirconia or it's the LT, the low translucency version of e.max, that'll keep it from showing through. There's a couple different approaches, and then the one where it's the impulse or the higher translucency version of the e.max is where we can see really that outline of that prep kind of showing through there. And that's a good time to let your lab know either, I've got a cement that I want to use that's not translucent, or I've got a dark stump shade here. You can take a photograph. Ivoclar makes a stump shade guide if you don't have one of those. But typically a photograph just next to like an A3.5 shade guide will give the lab enough of an idea so that you don't end up being able to see the preparation through there. And of course, if you use that reverse prep method that I like so much, now you're using depth cuts and assuring that you're going to have at least a millimeter, maybe 1.2 millimeters of reduction on that facial surface, and then nothing will be able to show through.